Welcome back to this review series. We are going to discuss lower gastrointestinal bleed. So it is, as we said before, it's distal to Treitz ligament and it still can be an upper GI bleed. So we can see fresh blood per rectum, melena or hematochezia. Now, once we see this, the same as in upper gastrointestinal bleed, we ask if the patient is stable or unstable. If the patient is stable, then we investigate. If he's not stable, we stabilize him. Now, regarding the patient, if the patient is stable, we do an EGD to rule out an upper gastrointestinal bleed as a cause of a lower gastrointestinal bleed. And we do also colonoscopy if the EGD doesn't explain the bleeding. And always remember to do the physical exam to make sure that the bleeding is not from anal fissure or from hemorrhoids. For unstable patient, we stabilize the patient, IV access, fluids, and blood products. We take initial labs. EGD can be done on unstable patient to rule out upper gastrointestinal bleed. If it's negative and the patient is unstable, we continue stabilization of the patient and then we do CT angiography to detect the source of the bleed. If the CT angiography doesn't show the source, then we can do something called technetium labeled RBC scan. It's a nuclear scan to detect smaller amount of bleed. Once the source of bleed has been localized, then we consult interventional radiology for embolization. If the previous methods did not show the source of bleed, then we consult surgery and we move the patient to the OR to control the bleeding and save the patient. Now, as causes of lower gastrointestinal bleed, we have the diverticulosis in elderlies, usually it's painless, and we have AVMs, vascular ectasias, arteriovenous malformation. These two causes are painless. We have the painful, when the patient is in pain, he say I. So we have three I's: infection, ischemic, and IBD. We'll discuss them later on in more details. Now, for the lower gastrointestinal bleed, we do colonoscopy if the patient is stable to confirm the cause. And we rule out upper gastrointestinal bleed using EGD. We do EGD even if the patient is unstable. We can't do a colonoscopy if the patient is unstable or having brisk bleeding. It won't show the source. And for the patients who are bleeding, we can use also the angiography and the radionuclear scan to detect smaller amount of bleeding and localize the source and embolize the source. And if the source is still unknown, after all the workup, we consult surgery for surgical intervention, moving the patient to the OR. Thank you for watching. Please subscribe to the channel. We will upload more videos and good luck on your examinations.